Today is the 948th day of the uninterrupted daily webinar of Ifph. Before beginning the session, let's have a silent prayer. Doctors, students of homeopathy, and lovers of homeopathy. Today, we are going to start the 948th continuous daily webinar of Ifph. And today, our guest is Dr.Chaitra Avinash. She's a passionate homeopath with over 15 years of experience. Let's have a quick look of her credentials. She completed her BHMS from Government Homeopathic Medical College and Hospital, affiliated to Rajiv Gandhi University of Health Sciences, Bangalore, with honors. Later pursued a master's in counseling and psychotherapy from Kuvempu University under the guidance of Dr. Ashok Pai. Also, she done postgraduate diploma in hospital and health management. Dr. Chaitra did 2 years of practice as a homeopathic medical officer from 2008 to 2010 in Government District Hospital, Davangere, Karnataka. Soon after her graduation, then began private practice from 2010 till date, and also worked under Dr. A. Ramdas and Dr. A. N. Sundaresh, who are homeopathic stalwarts in Karnataka. Being a doctor and healer of homeopathy, has vast experience in treating various chronic and acute cases, and has presented papers in various health portals and continued education programs and had television shows on healthcare. Also work with people to find out why they are ill in the first place, and then clearing the blocks and obstacles to optimum health and vitality. That's great. So the topic of discussion is clinical utility of Arachnida. Let's welcome Dr. Chaitra. And I welcome you all for the session. After the session, we will be having a time for interaction with the speaker. Doctor, let's start.
Thank you, sir. Thank you, Binduraj Balachandran, sir, for giving me the introduction. Thank you so much. I thank Ifph for giving me this opportunity again to introduce myself and conduct this session webinar. So I thank you all. And without wasting any time, we shall start the session. I'm going to share my screen. I'm audible, right, sir?
Yeah, you're audible.
The practical approach of Arachnida, that is the mental approach, the physical general, the physical particulars, the doctrine of signature, the pathogenesis, and clinical cases in today's session. So what is Arachnida? As all of you know, Arachnida is nothing but the group of spiders. So the spiders form the largest and most widely distributed order of class of animals called Arachnidae. So today, in this 40-minute session, I'm going to explain about Arachnida, that is the spider group. So since the time is very less, we are going to talk mainly about tarantula today. So the other spiders, I'm going to give you a gist, that is a brief description, but in depth, we are going to study, or we are going to see the cases, and we are going to learn the thematic presentation of Arachnida, that is tarantula. So before I start these slides, I'm going to show you a small video, like what is the attribute and what is the type, what is the exhibitionalism of spiders in general, as an animal, as an insect. Please give me 30-second time for the video. Please go through this video. So the spiders are very tiny. They are less than 5 mm. This is a peacock spider. It has many colorful features. That is the male spider which is dancing. So it is attracting the female spider through its dance. It is very impressive. Restless dance, rhythmic dance, right? Give me a second, please. So as we open the Kent Materia Medica, the first page itself, like we all see a rubric that is abrupt. So what is abrupt? Abrupt is nothing but sudden, unexpected, but in a very unfriendly manner, in a very rude manner, in an impolite manner. So Kent has described only 2 medicines under this. One is Natramure and another is Tarantula. Tarantula is a spider remedy, as we all know. So why does this abruptness come? I'm abruptly starting this because the theme of Arachnidae, the theme of Tarantula is very abrupt. It is sudden in onset. It is violent in onset. It is very restless. So when we come to natramure, the abruptness is mainly because, for example, the natramure female, as we all know, we have read the Kent Materia Medica. Kent describes like the natramure female, she falls in love with a married man, right? So she knows this is not right. She has that conscience. In spite of that, she falls in love with a married man. And that is because she develops an aversion towards the existing relationship. Because of the aversion, she develops this abruptness and she goes into another relationship. So this is the level of abruptness in natramure. Whereas when we come to tarantula, that is spider group, the abruptness, that is suddenness, is mainly because of attention-seeking behavior. They want to attract others. Otherwise, it is a threat for them. Otherwise, they feel very insecure. They feel that they are not able to attract the people who are around them. They feel that they are not so important. They feel insecure. So because of this insecurity, there develops abruptness in tarantula. So gone are the days where we were handling deficiency disorders, like in underdeveloped countries and developing countries. There are still a lot of deficiency disorders, right? Like mineral deficiencies, protein energy malnutrition, like kwashiorkor, marasmus. There is vitamin deficiencies, like vitamin A deficiency, xerophthalmia, vitamin B, beriberi, vitamin C, scurvy, vitamin D, rickets, osteomalacia, so on. So we are beautifully managing these deficiency disorders, right? So medical advancement is very good. So the deficiency of minerals, proteins, calcium deficiency, iodine deficiency, that is goiter, thyroid involvement, we are managing beautifully. But now in this generation Z, that is millennial generation, where there is the era of 4G and 5G, there is a lot of internet, there is a lot of electromagnetic radiations. Here, we come across a lot of neurodivergent disorders. That is lot of neurological disorders like autism, ADHD, dyscalculia, dysgraphia, all these things. All these neurodivergent disorders is taking an important role nowadays. So the medicines like Arachnida or the tarantula group of remedies plays an important role. How is that? We will see through these slides. So I will just give you a brief introduction regarding the history of spiders. That is, the spider word comes, it is an English word, that it comes from Old English spitra. It means spinning. We all know, right? Spiders beautifully build their cobwebs. So they spin these cobwebs. So the tarantula patients are very creative. So as we see this cobweb, it is creatively, it is beautifully spun by the spiders, right? To attract, to trap the insects, they build this cobweb. Thus, the patients of tarantula are also very creative, very artistic. At the same time, they are very mysterious. They're very mischievous. We'll go through that in the ahead slides. So spiders, they belong to the phylum Arthropoda. That is, they are classified under Arachnidae. So spiders are abundant and they are found all over the world. As per zoologists, there is an estimation of 30 to 40,000 spiders across the earth, but they are not found in Antarctica, except that like we can find spiders everywhere. So while we are speaking 1 centimeter beside us, we can see a cobweb or we can see spider, right? So that is the level of adaptability of spiders. They can even survive in the vacuum. So the patient of spider or the patient of Arachnida, tarantula who needs this medicine, they have this adaptability, like they can survive anywhere. They can survive in any climate. For example, there are some spiders which burrow the holes in the ground and they live there. So the patients of tarantula also, they can go into social withdrawal and they can lead a very silent life, a very solitude life. So as I told you, they are not found in Antarctica and usually occur at elevations from sea level. Lifespan is usually like spider is short living. So are the symptoms of tarantula. They are very short living. They are sudden in onset, they are violent in onset, and they are very of short duration. So spider lives up to 1 year, only tarantula, it may live up to 15 years. This is the lifespan estimation. So where does this word tarantula come from? So there is a town known as Taranto in Europe, from where every year it migrates to other parts of the world. So we all know the first case of tarantism was reported in 1370. So the symptoms in every part varying from pain and swelling, palpitation, vomiting with delirium, melancholia, depression, even ending in death. So this was the first case. Spiders are usually non-poisonous. Even if they bite, we do not exhibit any symptoms. but there are some spiders which are minutely poisonous to the human beings, and they might exhibit this tarantism. And when this patient exhibit all these symptoms, they miraculously found that these patients were better by music. So when there was music going on and they exhibited all the symptoms were better upon playing the music. So coming to the Arachnida class, there are two types here. One is Aranomorphae or Dipneumons. That is, they compare one pair of lungs. That is 2 lungs. For example, Tarantula hispanica. So these Aranomorphae or Dipneumons, they build the cobwebs in the air. So they have a pair of lungs. So next is Mygalomorphae or Tetrapneumons, which have 2 pair of lungs. That is 4 lungs. So they burrow the hole under the ground. They do not spin the cobwebs. They live inside the earth in a burrow. And example is Tarantula cubensis. So coming to the next slide. So generally, spiders are classified in 4 groups. One is cross spiders. So we have Arania diadema, Arania ixobola, Arania senecio in the cross spiders group. So next we have black widows. That is Lactodectus mactans, Lactodectus facility captivo, Theridion. Theridion is orange spider, we all know, right? Next is pool spiders, Tarantula hispanica. So mainly found in Spain. Bird spiders such as Mygale, Atrax, and Tarantula cubensis, that is Cuban spider. So this is in general classification we have simplified. These are the 4 classification which we found in Arachnidae. So as we all know, Arachnida is animal kingdom, right? There are mainly 4 classification. One is Ophidia, that is snake group of remedies. Next is the spider, that is Arachnidae. Next is insects. Last is fish group of medicine. These are the main 4 group of animal kingdom. Whereas spiders, we use Tarantula Arachnidae spiders in our clinics. Lot of patients nowadays, lot of neurological symptoms, lot of adversities in autism, ADHD, especially in pediatric age group. There is a lot of usage of all these medicines which belong to Arachnidae kingdom. So the main important remedies, there are many remedies. I have taken into consideration only 10 remedies now because of time availability. So number 1 is Arania diadema, that is spider papal cross, Arania senecio, gray spider, Tarantula hispanica, that is Spanish spider, Tarantula cubensis, Cuban spider, Theridion, that is orange spider, Lactodectus mactans, American black widow, Lactodectus cecility, that is New South Wales spider, Lactodectus capillo, New Zealand spider, Mygale lacidora, black Cuban spider, Tila arania, that is spider web. So coming to the historical background, so how did this name Arachnida came? So there was a female known as Arachne who was a Lydian maid weaver. She was a beautiful weaver. She used to create a lot of skill in her art, and she used to display her all art belongings, which was beautifully done. She was an artist. And once what happened, she invited goddess Greek for her competition. She invited Athena, that is Greek goddess, please come and compete with me. So let me have a competition of creativity, that is both of us will spun the art. So we'll see who will win. So this lady Arachne, she did this artist so beautifully that Greek goddess Athena could not win her. So in that shame, the Greek goddess ran away, and later she gave a curse for this Arachne. Arachne, she felt there was an injustice to her in spite of excelling in the this art competition. Greek goddess could not take it, so she hung upon herself. So seeing her plight, Greek goddess gave her a chance that go and live as a spider. So you should be 24/7 busy spinning the cobweb. So Arachne herself was changed into spider, hence the name of zoological class to which spiders belong came into existence. So coming to the spiders' life situation, spiders change little during growth except in size. So as we all know, they shed their cuticles 7 or 8 times before maturing. If leg is broken off, it is usually replaced. It has a lot of high regenerating capacity. So even we humans have, right? Humans have only one organ, that is liver. So which has a high regenerating capacity. Whereas spiders, they show lot of replacement. So this is, when coming to an individual, the spider individual has a lot of adaptability, lot of regenerativity, even in their constitution. So social behavior, some tropical species of spiders are social and they live in large communal webs. So they will be living in large webs. Some of them, they have a lot of social skills. They live together, they live in groups. So some of the tarantula people, they like to have a lot of friends. At the same time, some of them, like Mygalomorphae, who have 4 pair of lungs, they dwell in the holes, that is, they go inside the earth and they burrow the spin and cobweb inside the earth. So some species have withdrawal socially and they live alone and in solitude. So we can see both the extremes, both the social behavior in tarantula. The spider venom, only few spiders are toxic, and the venom of black widow spider and other Lactodactylus genus acts as painful nerve poison, and some may cause local bruise. Otherwise, the spider group of remedies are not very dangerous to the human existence. So uses and importance, spiders are very much important in ecological balance. Like without spiders, without honeybees, we cannot have an ecological balance. So there are a lot of insects. So while cultivating and in agriculture, nowadays we use a lot of pesticides, we use a lot of insecticides. They are manufactured in such a way that they do not kill spiders. So that one of the reasons for this is that the web of the spider may catch many more insects than the spider can use as food. So they build the cobweb in such a way that they are going to trap the insects, and in that they are going to use only some amount of insects as their food. So this have been used to control insects in apple orchards in Israel and rice fields in China also. So doctrine of signature, spiders have 8 legs. We all have seen spiders, right? They will be always busy 24/7. They will be spinning the cobwebs. They'll be very busy building their nests. That is the spinning activity. So the spider has 8 legs surrounding the whole body and it will be in constant motion. So the patients are always very restless. The spider patients are less restless. They are very hyperactive. They are very mischievous. They are very abrupt. As we started with abrupt. So they exhibit their symptoms in a sudden manner, in a violent manner, in a hyperactivity manner. They are very mischievous. So they lack this moral behavior. They lack the ethnicity. That is, for example, like the patient of tarantula, like he takes a beautiful butterfly, he tear the butterfly into pieces, is going to throw it away. This is the level of moral ethic which is present in tarantula group of patient. So what are the other remedies we can find under this group? So we can see other medicines like anacardium, medorinum, who lack this moral behavior, right? So they are always restless. Why are they restless? Because they want to attract people. They have this attention-seeking behavior. So they are like, if people do not observe me, if people do not see me, it is a threat to me. I'm going to die. So this is the insecurity. This is the level of insecurity which is present in tarantula. Because of that, they exhibit this restlessness and hyperactivity, which is the main keynote of tarantula. The spider captures its prey in a very cunning and deceptively woven web. The patients are very cunning and deceptive in their behavior. So we have a lot of children who come to our clinic, right? The school bus come at 9:30, 9:25, they feign their sickness. They tell their mother, oh, Amma, I'm having stomachache. I want to go to toilet. I want to pass urine. So this is the level of feigning sickness, right? Even we find tubercular children like who are very restless, who are very hyperactive. So what is the differentiating factor between this tarantula, tuberculinum, and other group of remedy? We have a lot of medicine in Metromedica which have mischievous, right? Mischievousness. We have medicines like Sina, we have chamomilla, we have antimonium crudum, even as I said, tuberculum. All of them are very hyperactive. They exhibit this mischievousness. But mischievousness is generally psychotic, right? When this mischievousness turns into a cutting edge, when it harms others, it becomes syphilitic. So tarantula comes here. When the mischief goes to an edge, when it causes harm to others, then we need to think about tarantula, because they are very cunning and deceptiveness in behavior. The way they build their cobwebs, the way they attract other insects in a cunning manner, in a deceptive manner, such is the mental thematic representation of tarantula or arachnid group of medicines. They exhibit such behavior because they are very violent, like because of suddenness. Whereas when we compare this to snakes, they take a lot of time. Snake remedies, they will be sitting back, they will be observing, they will be thinking, they will build a sketch, they will plan accordingly, and then for revenge, they attack. Snakes are such group of medicines. Whereas spiders, they do not plan or they do not have this steps while attacking. They are very sudden, they are very violent in onset, they are very cunning and deceptive in behavior. So the action of poisonous spider is very violent. As I told you, like the complaints are also very violent. They are very sudden in onset. Headache of Theradion. We all have seen Theradion, right? Orange spider. The headache is very sudden in onset. Even the slightest noise brings headache in the person, right? So they are very violent. They are very sudden in onset. And also many of the symptoms are of short duration. The male spider is known to dance during the mating season to attract the females. The patient desired to dance, which relieves his complaints. As we saw the video at the starting of the session, we saw a female, that was a male spider, which was very colorful. Usually in God's creation, females will be very colorful, right? In human species, when we compare, like beauty is kept aside for females when compared to males. Whereas in spider, it is vice versa. It is ulta. Like male spiders are very colorful. They are very tiny when compared to female. Female spiders are very large. Male spiders are very small. Female spiders are very capable. So male spiders have this insecurity. They want to attract the female spiders. If they fail to attract, the female is going to eat them. They do not think them as potential partners. Females do not consider them as potential partners. They think them as food and they are going to swallow them. So the threat, the constant threat, insecurity, this behavior creates restlessness, hyperactivity, mischievous behaviorness. All these things is the doctrine of signature. Once we come to know the theme which is present in the spiders or arachnidae, the same set of symptoms, the same set of exhibitioning, the patient conditions, we can match accordingly. So the doctrine of signature helps us in matching the symptoms of the patient and the source of the drug. So the main characteristics of spiders group, the constitution, as we know, like they are always restless, they are nervous, they are hypersensitive. They are very, very hypersensitive. Why are they hypersensitive? Because of restlessness. So they are so hypersensitive that they are going to rub their head in the pillow. They cannot stay still, they cannot stay quiet. One of the main characteristic group, one of the main characteristic modality of this arachnidae group is that this hypersensitivity is ameliorated by rubbing, whereas there is aggravation touch. So people with artistic traits and very active behavior and very colorful personalities, like this is the constitution of spider group. Miasm, they fall under tubercular and psychosyphilitic. They are very restless, they are nervous, irritable, they are very chilly and sensitive to cold. So Arachnida diadema is the chilliest among all the medicines in spider. So what is the other medicine we can expect in materia medica, like which is very chilly? We can accept sorainum, right? Sorainum is one of the chilliest medicine in materia medica. The patient wears a fur cap even in summer. So when we compare that, Arachnida diadema, arachnidae, all spider groups are very chilly. So sphere of action, they act best on mind, blood, skin, CNS, like special peripheral nerves, head, heart, extremities, even reproductive organs. So ailments from noise, motion, grief, stooping, closing eyes, sound, riding, washing, sea traveling, sepsis, disappointed love. So in this era, like we all know medicines for disappointed love, right? So if it is because of acute condition, it is ignatia in general. Like if it is chronic, it is natramute. When disappointed love is there, you have this feeling of very sensitivity and abandoned feeling. It is pulsatilla. When because of disappointed love, you go into shame, it is staphysaggria. You suppress your anger, it is staphysaggria. So what is the difference between disappointed love and unrequited love? So Fatak explains a line in Tarantula hispanica, that is bad effects of unrequited love. So we see a lot of cases, right? Nowadays, like unrequited love is a one-sided love which is not attended by the person in reciprocal. So this sentence, that is the bad effects of unrequited love. So we can think about Tarantula hispanica. So there are a lot of pathophysiological changes, that is it poisons the blood, especially Tarantula cubensis. We see a lot of gangrene, we see a lot of septicemia, we see a lot of carbuncles, we see a lot of skin complaints in Tarantula cubensis. We also see malignancy, and we also see last stages of death, that is to improve the quality of life, or even for mercy killing, that is for euthanasia, we can prescribe Tarantula cubensis in the last stages of the patient's life. So coming to the clinical attributes of this Tarantula. So as we told, activity, hyperactive, purpose with. So these are the main rubrics where we can see Tarantula. So there is an hyperactivity in children, especially autism, ADHD, dyscalculia, dysgraphia, all these symptoms, when they exhibit, we can think of Tarantula. So the level of hyperactivity is in such a manner that when the mother is cooking in her kitchen, the child would be silently watching the TV. Suddenly he gets up because of his hyperactivity. He goes into his cupboard. He takes all the clothes from the cupboard. He makes them fall. He can set it into fire and he can come back and sit quietly. So that is the level of hyperactivity with mischievousness or destructive syphilitic tendencies in Tarantula. So there is a lot of threatening, that is a lot of words of destruction are used in Tarantula. For example, like when a patient, when a kid was not eating properly, he was brought with his mother. We had a doubt that how is he existing without eating any food for about a month. This was continuing in his house. He was mainly eating the mud from outside or some undigestible particles like pica. So when he was brought into clinic, when he was questioned, like, why are you doing this? Why are you not eating? The response was, who are you to ask me? So that is a threatening response. The kid of 5 or 6 years age old gives a threatening response to strangers. That is, which is very, very violent, lacks control, moral depravity, hateful, throws things away, maligning, that is fiends, the fiend sickness, that is psychosomatic illness, like convulsions, all these things occur upon attention seeking. There is kleptomania, that is when you are not seeing the kid in a school silently walks, he takes the pen from his friend and he walks away. So when there are no observers, there is no hysteria. That indicates the attention-seeking behavior. So all the complaints of Tarantula is better by dancing. That is dance desire to amelioration, dance desire up and down. There is a rhythmic movement. There is an amelioration while dancing, horse riding, up and down motion. So this keeps the patient restless all the time. And he is very wild. Tarantism is the term applied to dancing mania set up in persons bitten by Tarantula. The cure is music and dancing. These symptoms give us keynote indication to this remedy. That is, they are very sensitive to music. So they are very hyperactive. Hurry, haste, that is Tarantula. Hurry, they should be hurrying, always in hurry, hurry, hurry. We had a patient like he had a pain in heels, that is calcaneus spur. So he cannot wait at the reception. Like, jaldi karo, doctor, jaldi karo, finish it fast, finish it fast. He can never wait. So taking like it is very characteristic. He was such a haste, he was in such a hurry all the time. Whenever he used to visit the clinic, he was in hurry. So considering all his symptoms, he had pain in heel, that is calcanea spur. Lot of sensitivity to cold. Arachnida edema was given with lot of improvements. So the patient is restless, fidgety, hurried, constant motion, walking through verse, rolls on ground side to side. That is friction amelioration, whereas touch aggravation, strikes vehemently, relieves all his distress, that is friction, relieves the distress. There is quivering, jerking, trembling, that is chorea, twitching. All these nervous symptoms are exhibited in tarantula. They're fruitlessly busy. This is called industrious, right? We have a rubric called industrious. That is, they are very busy. So we have a lot of medicines. Tarantula and pteridine also comes under this. That is orange spider. So colors, amelioration. This tarantula patient likes color. They like lot of color. They desire color, especially blue, green, red, all these colors. Kids, like in kid, when we design kid room, we make it very colorful, right? So the tarantula kids also, they desire the color in a very, they take it in a very positive manner. So we have other medicines like stramonium where the lights, especially the stammering lights, they bring on aggravation. That is stramonium, right? Unlike that, here in tarantula, there is lot of amelioration in bright light. There is aversion to blue light, especially in some cases, we can find aversion to blue light. This is in general. There is lot of delusions in tarantula, especially upon closing eyes. They see a lot of ghosts, they see a lot of phantoms, they see a lot of people, they see black people, they see strange people. These are the delusion which is present in tarantula. So as I told you, like in unrequited love, that is in one-sided love, there is a lot of insanity, madness, love disappointed from, that is tarantula can be used. There is a lot of restlessness. There is a lot of sleeplessness. When the sleeplessness or insomnia is present with all these characteristics, we can prescribe tarantula. So there is hypersexuality, that is erotic sexual, lasciviousness, all this is present in tarantula. So the madness is in such a level that they have this threatening tendency which leads to destruction and also death. So there is a lot of hysteria, that is feeling sickness, attention-seeking behavior, especially hysteria, attention from tarantula. So this is taken from Dr. Jawahar Shah sir Zomeo, this app. So ailments from scolding, punishment, love disappointment, bad news, good news, excitement, grief, sorrow, sensory impression, being alone, fear of people. So this is the positive factors of tarantula. There is a lot of disobedience. They're very strong, they're headstrong, right? They're very abusive, that is threatening. There is a lot of violence present in them. They are sly and foxy, that is, they are very mischievous. They are very foxy. Foxy means mischievous, which is cunning, which tends towards syphilitic. So they have this company aversion to. Some of the spider group, they desire to stay in solitude, which I have already explained. Desires dark, lies down in darkness, aggravation, contradiction. We cannot say opposite to tarantula group. They will become very impulsive, they will become aggressive. So hide desires too, that is they dwell inside, they withdraw. Their cunning, speak lies, kleptomania, curse and swears. There is inhumanity, cruelty. There is a lot of syphilitic tendencies seen here. In spite of that, tarantula patients are very creative. They are very imaginative. We see a lot of artists. We see a lot of craftsmen which fall under this tarantula group. So hypersexuality is plus in tarantula. There is mania, that is dancing and singing. Dancing is, all the complaints are ameliorated by dancing in tarantula. They have this desire for music, they have desire for dancing. So they feel sickness when when nobody is observing them, there is no complaints, there is no hysteria, there is no asthma also. So, and one of the interesting factor is that whether it is respiratory complaints or nervous complaints, so all these complaints are better by smoking because they desire stimulants, right? So because of this, one of the main feature of tarantula is complaints are better by smoking and better by rubbing. We are going to talk about few quoted cases now. That is Mr. X case of hyperesthesia of fingertips. The patient, a lady 33, could not dress herself without gloves. The irritation caused at once a sensation in the teeth as if set on edge by a strong acid. The pain was not in the fingers. Tarantula gave relief. After acerem, gelsemium, and sulfuric acid had failed, tarantula could give a good result for hyperesthesia of fingers. That is, there was lot of tingling, numbness, this sensation, that is neurological symptoms. She could not dress herself. So tarantula was given in this condition, that is peripheral neuropathy, hyperesthesia. We see a lot of tremors. There are other conditions, right, where we see tremors, like it can range from simple fatigue, that is malnutrition, or hyperthyroidism, or Parkinson disease, where we see pin rolling tremors, or it can be seen in alcoholism, that is deliria tremens. It can be seen in myasthenia gravis. Lot of trembling is present in myasthenia gravis also, right? So in myasthenia gravis, trembling is found with decrease in energy. Whereas in Eaton-Lambert syndrome, this trembling is present, whereas the energy levels are very high. So in these peripheral neuropathies, hyperesthesia, paresthesia, we can think about Tarantula hispanica. So another case, a girl 3 months old was bitten by tarantula. She appeared at first uneasy and then exhibited symptoms of dyspnea. Complaint shows sign of suffocation, vomited, and was agitated and much convulsed. Music was played, movement of the limbs were set up, when resulted profuse sweat followed by sleep and complete recovery. So these are the symptoms which are mentioned by our masters. So music brings amelioration in tarantula people. So when there is symptoms of any respiratory symptoms or any neurological symptoms, when there is lot of agitation, when there is convulsions, when music is played and they become better after that, that is sensitivity to music, we can think about tarantula. So Boger explains a case of irritative cough. Mr. X was sore all over the body, throat feels dry, cough lying down at night and in morning after rising, dry with tearing pain in chest, excited by pressure of phlegm in chest, shortness of breath after an hour each, coughing, amelioration from smoking. So all these symptoms, all these respiratory symptoms are better from smoking. Bad taste in the evening, 3 doses of tarantula cured the person. Diphtheria, tonsillitis of an intensity to threaten suffocation, cystitis, septic and intermittent fevers have been successfully met in tarantula upon its indications. So PC Mujumdar reports a case, girl 18 had oppression of chest, suffocating sensation, continued jerking and movements of hands, foam in the mouth, complete insensibility, profuse and delaying menses, very sleepy, hysteroepilepsy was diagnosed, psychosomatic symptoms again. So Ignatia was prescribed because of the psychosomatic symptom, feeling, the sickness, hysteroepilepsy did nothing. Then tarantula brought her out of the fit and restored her completely in a few minutes. So we can think about tarantula in these conditions. Tarantula is not only a historical remedy, it is much more, it covers all the neurodivergent symptoms. So, sir, time is there, sir? Time is there, right, sir?
Yeah, yeah.
Time?
We have. We can go on.
I will present a case. Like we are going little deep in this case. This is a case, 5-year-old boy complained of cough and cold accompanied by his mother. So when we get a case of any like respiratory complaints, like people who especially like parents cannot like, we cannot label their kids, right? They only know what symptoms they are suffering from. But when the deep pattern is analyzed, we can elicit that there is some neurodiversity which is present in the patient. We'll go through a case. So this cold and cough, his complaints always start with a cough followed by low-grade fever, nose block, and loss of appetite. And most of the time he was put on allopathic medications. He was feeling better after the medicines, but the complaints were recurring again and again. So like 3 to 6 years age group, this is the age group where people fall ill again and again, because up till 3 years, they will be safe at home. After 6 years, their immunity will be strongly built up. Between 3 to 6 years, like when we send them to nursery, we send them to pre, we send them to preschools, there will be a lot of exposure with their friends, with their peers. So this is the time they are building their immunity and they are exposed to repeated viruses or repeated bacteria exposure will happen. And this is the time, this is the age group where homeopathy can help. We can miraculously, without any side effects, help them to cure naturally and build their immunity and resistance. So his complaints always started with cough and low-grade fever, nose block, and loss of appetite. And most of the time, as I told you, he was put on allopathic medication and he was feeling better. History of presenting complaints, symptoms got worse in sleep. At nights, he used to like cold drinks, but after having the cold drinks, especially like with colors, like he used to write like Maza, Fanta, orange juice, mango juice, these types of juice. He used to like, and he used to have it, but soon after having this, he used to develop the complaints. Like they used to hide them when he is not noticed by anyone, but he used to silently open the fridge and drink them. Generally, he feels better when taken in open air. This is one of the important symptoms which we got to know, that is his cold and cough was better when he was taken outside and with warm drinks. Warm drinks, like it is a general symptom, right? When cold and cough is there, when you give warm things, they especially feel better. Whereas open air exposure is a peculiar symptom here. Past history and history of low ferritin in the past, iron levels for which he was injected iron intravenously. When we asked about life space investigation, his mother started to describe him as a loving and caring child. His mother narrates the incident. His friend has left an umbrella in his bag and his friend ran up and gave to him. When his mother is unwell, he presses his mother head. He takes care of his mother beautifully. He's a light sleeper. His grandmother threatens him, if you are not going to sleep, like your mother is going back to office, and if he sees a lot of mobile or screen, they used to scold them. So this would make him upset with shocking look. He needs light while sleeping. The mother asked him why he is scared of, and he said that he was afraid of rats, especially because one rat came onto his mother and jumped on him. He whispered in his ears that he was afraid of new people. His mother said he was going to shell, or when he is with too many people, he cannot interact and he would stand aside. There were like social skills was yet developing in the kid. Patient started yawning loudly, making strange noises and laughing without any reason. So when we asked why is he doing that, mother explained that it was just for fun. So when she would talk to her sister or anyone else, the child would want to be heard. He feels that he should be given first preference and he wants attention, especially like he cuddles his 10-year-old sister and he wants to do the same. He loves to make people laugh. Once comfortable, he will make people laugh. So later in case taking, like we came to know, like he had some hyperactivity and he had some symptoms which were not neurotypical. So mother played some movies and suddenly started dancing. Mother added that he was very fond of music. Excuse me, that is orange drinks, cold drinks, fruity. He loved orange colored drinks. And as progress, mother reported he became very aggressive. When he became aggressive, his response was he used to shout, yell. He misses his mother. When angry, he would pinch his sister especially and shouts very loudly. The observation was when he was angry, he would hit his elder sister and he would kick his mother and also pull the hair. Also, when angry, he started to speak lies and he had started using bad language. Maybe he has learned from the school, which had started a year back. Mother also reported that he became very hyperactive and restless, cannot sit at a place for long. After like 3 to 4 years, it is a bit difficult to make the child sit at a place. 5 years, we expect at least 2 to 3 minutes they sit at a place, which was not happening. And he loves to touch and hug them. He would often come to mother and kiss her. So we took mother's case history in general. So what we came to know was like she was extremely stressed as her in-laws wanted another child, which was not in her mind. So she was extremely fearful about the outcome of her pregnancy, as previously she had gone through a lot of miscarriages and abortion, and very uncomfortable to undergo one more kid as she had to suffer this again. So the main experience in this situation was she was feeling like she was trapped because of parents-in-law pressure. She had to go with another issue, which she was not comfortable. But she also felt that each time she would dress up and try to look good, her husband would always complain about her weight gain. So taking her a step deeper from the situation to her experience in this situation, she spoke of feeling trapped in hand gestures, like she was telling, like she feels suffocated, she feels claustrophobic, she was feeling worthless. Especially in pregnancy, there would be a slight weight gain, which she was expecting husband, like she should praise him, but they will be busy in their own activities, right? So which was not happening, and she was feeling worthless and useless about herself. She wanted to be independent, but felt she made in this situation, she wanted to be independent and she wanted to come out of it. As we come in the analysis of the case, the child is very active, loving, caring, affectionate. We can see two polarities. One is the child is kind-hearted, he helps his classmate. At the same time, he gives us an energy where he shows a lot of mischievousness and neurodivergent symptoms, so which gives us a hint towards the animal kingdom. When there's claustrophobic, when there's coming under a roof, that is trap sensation, bounded, no escape, so aggressiveness, all these things were present. So takeaway message today is like, when we often prescribe Arachnida group of medicines, we can see a lot of attention seeking, sexuality, rhythm in their complaints, dancing behavior, being trapped. There is a lot of prank tricks, mischievousness. There are quick witty, that is sudden impulsive moves. There is a lot of pretense. There is cheating, mimicry, restlessness. So we have taken the mind abusive children, that is as a rubric, behavior problems, dancing, deceitful, anger, kissing everyone, pulling hair, restlessness, sensitive to music, striking in, and cough and cold, generalities, amelioration in open air. So we have got a group of medicines like Tarantula, Naxomica, Lycopodium, Tuberculinum, Natramute. So the boy received Tarantula hispanica 1 mg 1 dose. The child was given 1 mg potency since it was in delusional level. So after 4 weeks, he was much better and we continued with SN. So after 3 months, his aggression, anger, striking were better, but he still had this suddenly jumping behavior. Cold and cough were present. So we repeated the dose. After 4 months, after receiving once again a dose of Tarantula, like his temperament has improved. While he continues to do a lot of mischief, his anger has reduced, his attention seeking was still there, but less. Overall, the intensity of cough and respiratory complaints has significantly come down, and he has responded very well to homeopathy. So when there is a repeated bouts of respiratory infections, it decreases the concentration level even in academic performance, right? So Tarantula hispanica and homeopathy has helped this child come out of the infections again and again, and he is doing very healthy. So Tarantula group of medicines, we should not miss out when we find them, because they are very characteristic. They are we can find them very easily out in the crowd, right? So I think we can end this session with this. So I thank International Forum of Promoting Homeopathy for giving me an opportunity again to express myself here. I thank all the audience for being patient and listening upon this amateur. So thank you, Bindurajan sir. Thank you, Danesh sir. Thank you, one and all again. Thank you, sir.
Great, doctor. It was great. I was thinking that the time was going out and a lot of persons will be here to interact with you. But I was very much reluctant to interfere, as it was a good class. My mind was also going like a spider because it's so fast, great, touching all the aspects, cross-referring, everything, comparing. Great thing. So we are having with us, can you name the person, Android? Who is the person? Let me unmute you. You can speak now.
Hello.
You can unmute.
Am I muted, sir?
Yeah, you can ask. Android do droid. There's a person there, hand raised, and if anyone need to interact with the teacher, you can raise your hands in the participant list. That's Dr. Padran.
Thank you, Dr. Chaitra, for your magnificent presentation on tarantula, and I have very much good experience with tarantula in case of mischievous children who are autistic also, and would had the chance to cure also. The first experience of while I was studying, my grandmother temperature then trembling body, during like anything. I was at first I was feeling joyous, but later she used to develop me also. I immediately dropped a dose of tarantula cubensis. Within 2-3 seconds, all the shivering went down, and she was healthy. And she although she is a licer, gave me 10 rupees at that time in 1974, I think. I had very good results with tarantula, and I was practicing with tarantula since that time while I was studying also. On my second year, I think, second year of DHMS. Thank you for your very good presentation, and expect such presentations later also. Thank you.
Thank you, Dr. Padran. That's great. And more to add. So, for one-sided diseases and psychiatric disorders, we can prescribe tarantula well. And also when the cases is full-blown, we are finding the medicines, we are studying the whole case, and we are going to find out, we are getting the whole case in a perfect picture, perfect mode. We can treat any disease. Is it right, doctor?
Yes, sir. Yes, sir. Exactly, sir.
And which potencies or which type of centesimals or millisимals, which are you using for this?
Yes, sir. In mental disorders like their mental thematism, like neurodiversity cases, we are using high potency, sir. 1M, 10M, we are using, sir. LM potencies also we prescribe, sir, when the patient requires that. Whereas when the patient comes with any like skin symptoms which are very chronic, like septicemia, gangrene, like other septic conditions, we are prescribing in the low potency, especially if the patient is old aged. Like we see a lot of ulcers which has developed because of sleeping on long-term basis. Even upon prescribing water bed, they are developing bed sores. So under these conditions, we are prescribing in low potencies, sir. So depending upon the susceptibility of the patient, so we put them on the potencies, sir.
Right.
So
Dr. Dhanesh?
Yes, good evening all, and good evening, Dr. Chaitra. It's really one of the best presentation in this platform, because you have beautifully narrated how these remedies from this family works here, and particularly tarantula, you have specified specifically, and that usually I would like to add one point to here, that usually when a tarantula patient, whether it be a girl or child, a boy, while walking through or while playing or dancing, she may have a very big fall on the floor, or sometimes somewhere hit. But even during that time also, she may just run away that nothing has happened. And this is the way, but frankly, she may suffer later. But openly, she won't never say that I have this kind of pain during that fall or like that. Am I right?
Yes, sir. Yes, sir. Correct, sir.
Yes, this is the thing that you have to observe when you take cases, because patients used to say that doctor, this pain has happened some 2 days back, but she did not mention anything about. But now she is very difficult to move away, and she cannot even walk to the school, or she cannot even take the books. But still, she is not requesting us to have some medicine. This is the mind of typical tarantula. This is the thing I would like to add to this person. Anyway, it's really a wonderful session. I hope that you can come up with some more presentation on the same subject. Your cases are also were brilliant. Thank you, Dr. Binduraj as well.
Thank you, sir. Thank you so much.
So I think it's the time to conclude the session, and the time is now nearing 9. I welcome Dr. Manoj for the vote of thanks.
Thank you, Dr. Binduraj. It is a nice presentation, and it raised a question regarding the knowledge on the fundamentals of homeopathy, how it becomes important, what is the relevance of studying the philosophical study part of homeopathy is most important. Very nice presentation, and these young physicians are really promising to the future of development of homeopathy. On behalf of Ifph, I am expressing sincere thanks to Dr. Chaitra for a brilliant presentation. Thank you.
Thank you, sir.